So good day everyone, my name is Laila Jean Casa from BSN 212A and today I will be performing a return demonstration in initial newborn care. So this procedure allows us to have a baseline data of the baby's well-being, and also in this procedure we are going to provide primary medications to the patient. So after this, we are going to wash hands to ensure that we prevent the spread of microorganisms as well as to prepare all the necessary materials that is needed for the procedure to ensure that all necessary materials are readily available. So the equipments to be used are the following: a weighing scale, a linen, thermometer, tape measure, working gloves, syringe, the medications, um, alcohol. We are also gonna need the baby's crib, the baby blanket, bonnet, pajamas, and then the shirt of the baby, as well as the mittens and the booties. So after ensuring that all necessary materials are already available, we are now going to identify the patient's name to from its name tag or name band and on the patient's feet. So we are going to check if we are doing this correct procedure to the right patient. So after identifying that we have the right patient, we are now going to enhance the comfort by making sure that the room temperature is warm. So after ensuring that the temperature is warm and it makes the baby comfortable, we are now going to place the linen over um, the weighing scale, and then we are going to instead perform or do the hand rubbing before putting on gloves. So this protects us, not just the baby, but as well as um, the ourselves from harmful microorganisms. So after putting on the gloves, we are now going to weigh the patient or the baby onto the weighing scale properly and correctly to get the weight of the baby. So in weighing the baby, we must remove the covering. So the baby weights is 3.2 kilograms, which is in the normal. So after weighing, we are now going to prepare the medications to be used. So first, we must put the CRIDS prophylaxis onto the patient's eye. So we are going to do this to avoid the eye infection known as ophthalmia or ophthalmic deonatorium. So this, in doing this, we must shade the baby's eye from light to avoid startling the patient, as well as opening one eye at a time, and then applying a gentle pressure on the upper and lower lid of the baby, and then applying the medication onto the patient's inner to outer canthus, and making sure that um, we prevent the medication tip accidentally touch the patient's eyes. So after that, we are going to inject vitamin K to the baby's middle third lateral aspect of the left thigh to ensure that we have the right side and administer the medication properly. So we are going to withdraw a 0.1 ml of the medication. So the purpose of placing a or injecting a vitamin K to the patient is for us to ensure that um, we prevent any blood clotting or hemorrhagic disease on the patient. So after withdrawing the right amount of vitamin K, we are now going to inject it into the middle lateral aspect of the patient's left thigh. So we are doing injection in intramuscular. So after injecting vitamin K, we are now going to inject the Hepa B vaccine. So this provide a early protection from hepatitis B. So we are withdrawing 0.5 ml of Hepa B vaccine. So we are going to inject it still in the middle lateral aspect of the patient's lateral aspect, but on the right side or right thigh, so that we ensure that um, we are injecting the medication in the right side. So now we are going to inject it into the right side of the patient's lateral aspect on the right side. So after injecting, we are now going to gently or carefully measure the anthropometric measurement of the baby. So we are doing this to have a baseline measurement of the baby's head, the baby's chest, abdomen, as well as the length of the baby. So in doing so, we must use a tape measure to measure first the head circumference. So we are going to measure it in centimeters. So we are going to place it under the baby's head, and then in line with the baby's eyebrows. So the baby's head circumference is 26 centimeter, and then we are going to check on the baby's chest circumference. So it should be in line with the baby's chest area or in the nipple area. So it measures 25 centimeters. So now we're going to measure the abdominal circumference. So it should be in line with the baby's um, umbilical area. Okay, so the baby's abdominal circumference is also 26 centimeters. And then we are going to check the baby's length in portion to ensure that we accurately get the measurement of the baby. So the baby's length is 40 centimeters. So after getting the baby's anthropometric measurement, so after measuring all those areas, we are now going to check the patient's temperature rectally. So we are going to place the thermometer onto the patient's rectal area to check for the core temperature. So after checking the patient's temperature in the rectal area, so we are now going to um, let the baby wear the newborn's diaper and also the clothes to help keep the baby warm. So we are going to wear first the baby's diaper. And then the baby's shirt. And then after the shirt, we are also going to allow the baby to wear his or her pajama, and then the mittens as well as the booties and the bonnet, and wrap it in a baby blanket to ensure that the baby will feel warm. So securing the baby's clothes not too tight and not too loose. After also wrapping the baby, we are going to place it into the baby's crib, and then putting the drop light to provide warmth to the patient, and also placing the crib tag to provide identification of the baby. Securing also the baby's mittens not too tight or too loose. That is to putting on this prevents the baby from scratching um, her face or her other body parts. So to place the baby blanket, we are going to place it directly into the baby's crib so that we can easily place the baby there and wrap the baby. So, um, putting now the drop light onto the baby's crib, and as well as the baby's name tag. So assuming I already turn on the drop light to provide warmth to the baby. So after that, I am also going to take the vital signs of the baby, checking for the heart rate, and then checking also for the respiratory rate, as well as to check again the temperature of the baby, but now on the axillary area. So checking these vital signs would help us check if there are any abnormal temperature or vital signs of the baby. So checking for the baby's vital signs like the heart rate and the respiratory rate, counting it in full 1 minute. So assuming I'm already done getting the baby's vital signs. So now I am going to do the aftercare of the um, baby. So in the area to maintain cleanliness, and also discarding all necessary items that I've used to maintain cleanliness and avoid contamination. So after that also, I am going to record and document all necessary procedure that I've done, and then if there are any other observations that I've did, to ensure that I have a legal documentation, as well as a baseline data for the continuity of care of the patient's condition. So after that, after ensuring that I'm done cleaning, so now I am going to um, document the necessary findings. So after documenting, I am now going to go to the baby's mother, and then allow the mother to ask questions or with regards to the procedure that I've done, if they have any concerns also, so that for me to be able to assist them and also to address their concerns. So that's all, and thank you.